It's another Wednesday with your fertility specialist. On behalf of Alps Hospitals, we love to say thank you to our dear viewers. Thank you for liking our posts. Thank you for sharing. Thank you for always staying glued to your screen. Today, we're talking about ICSI, when and why. I know a lot of people are wondering what's really ICSI. So, we have a very, very professional, high rating professional in the field of ICSI, in the field of embryology, that will be taking us on this topic. So do not be worried because he's going to simplify it, yes, to the barest minimum, I would say, to the best way that you can understand. So please keep your fingers crossed. Drop your thoughts, your comments in the comment section, and we'll definitely respond. Also, drop your questions as well. We have a guest with us, like I mentioned earlier, in person of Mr. Stephen Olarinde. Mr. Steve, it's good to have you with us today.
Thank you for having me, Martin.
So, for the sake of someone watching, a bit about Mr. Stephen, he's a senior embryologist as well as the head of embryology unit at Alps Hospitals. That's just a bit about him. I'm sure if you want to know more about him, you can chat us on our DM. We'll tell you more details about him. But for the sake of this session, that's just a bit about Mr. Stephen. So we'll be talking about ICSI, when and why. I'm sure, like I mentioned, some people are wondering what this is, Mr. Steve. So maybe you tell us a bit about what ICSI is, first of all, before we now start talking about other things, why and all of that.
All right, thank you. So ICSI is basically intracytoplasmic sperm injection.
Oh,
So
okay.
it's a process in IVF treatment where a single sperm is injected into a matured egg in order
Oh,
to achieve fertilization, then development into an embryo before embryo transfer happens. So ICSI is that process where a single sperm is injected into an oocyte using a machine. Of course, there's a machine we call the ICSI machine. So there's a place where you hold the egg, there's a place where you immobilize and
mm,
have the sperms, and then you inject. Let me don't go too technical about it, but there's a machine you use for that. So the short form of ICSI is intracytoplasmic sperm injection. So you
mm.
inject a single good matured sperm into a matured oocyte. That's
Okay.
basically what we do.
Okay. Okay. So hope we noted that. So well, is there a difference between this ICSI now and what is done in the conventional IVF, like in the way you put fertilize the egg?
Yes, definitely there is difference, and ICSI is a form of IVF treatment.
Mm.
So there's ICSI treatment and there's insemination or conventional, as some people call it.
Oh.
So in ICSI, there are a lot of factors that can actually account for you doing ICSI.
Mm.
It could be maybe frozen oocyte. If you want to do frozen oocyte treatment, ICSI has to be done. If there's PGT treatment, maybe you're treating for a particular sex selection, as we call
Oh.
it, whether for
Oh.
XY, that's for boy, or
Mm.
XX for male.
For
The sperm
female.
sorting is done, and then
Mm.
ICSI is done.
Okay. I
Then
see.
for people that have teaser or pizza, testicular sperm aspiration or testicular sperm extraction. So those sperms are not very matured sperms. ICSI is what will be done to treat those kind of sperm, because in a conventional treatment, you're looking at the motility of the sperm, the morphology, and the count. So those are the parameters that determine whether you're going to do ICSI or you're going to do insemination or conventional insemination.
Okay.
Usually these sperms are concentrated and washed. So if there is a fall in this parameter, maybe motility is poor, count is poor, morphology is poor. Those are all factors that make you consider ICSI for this patient in order to maximize their chances of achieving success with IVF. So there is a good difference. For ICSI, the sperm's quality are not very good. So you have a way to treat to get fertilization for the insemination, the sperm quality, that's the motility, the morphology, they are
Mm.
great. So you
Oh.
wash, you concentrate, and then in the lab, what we do is you put the eggs inside a dish, then you put a sperm inside the dish, you inseminate these sperms inside the dish, they swim to the eggs for fertilization. In ICSI, you have to go and immobilize the sperm, of course, using an ICSI dish where you
Mm.
place the egg, the sperm, you mobilize the sperm, then you go to the egg, holding the egg in position, and then you inject to achieve fertilization. So the difference in one, there is much sperms needed, at least for the conventional, you're looking at a ratio of about 100,000 sperms
Okay.
to one egg.
Oh, okay.
For ICSI, you're just looking at one good sperm and one matured egg.
Oh, I see.
So that's the major difference between the conventional and the ICSI.
Hmm.
But a whole other factors play a role in
So
determining
for
this.
the conventional one, it's the should I say the fastest wins the race.
Yes, the fastest win the race, and in some cases, research has shown that some of these eggs secrete chemoattractants
Oh,
to to attract the kind of sperm they want to
oh,
fertilize them.
oh,
So yes,
okay.
survival, the best survival or the strongest win the race.
Hmm.
But sometimes these eggs have a way of picking the particular sperms they want to get them fertilized.
So viewers, hope we're learning ICSI. So ICSI is more like they carefully choose the sperm
Yeah,
that they would
carefully choose the
eventually use.
sperm.
Unlike insemination, they allow the sperm just randomly meets with the egg, even though the egg will be doing shakara for the one that she wants, like he said. But literally, it's a random thing that the sperm just meets the one that is able to catch up with the egg, and then yes, while for the
Ex-
ICSI, they have to pick the best sperm from their assessments, or they're able to pick from the few sperm for those people that have very bad
Very
sperm,
bad
that you
sperms. Yeah.
see a lot of dead ones and you're practically searching. I mean, this is your field. I'm sure that
Yeah.
you have.
That's why I said the quality of the sperm plays a role in ICSI,
Mm.
whether the count is more or low, whether the morphology, by morphology, how they look, the good ones better than the bad ones, then the motility, how they move. Because if you're classifying sperm's motility, you're classifying the fast ones, the slow ones, or the non-progressive ones, as we term it. So depending on the constituent of these types of sperm in your the semen, the whole sperm,
Yeah.
those are the factors that you look at while ICSI. Another factor is for those that have retrograde ejaculation. That's those that
Okay.
their sperm mixes with urine when they produce it.
Oh.
Of
Mm.
course, there's a process of washing and purifying these sperms. ICSI is what is done to
Oh.
achieve. Yes, you do ICSI for this
Okay.
set of people. So apart from sperm, PGD, those that have retrograde injection, then if an oocyte is frozen, like I mentioned earlier,
Mm.
ICSI is the form of treatment that you use to treat those kind of patient because already your egg, the zonal pellucida, the cumulus rather, the OCC complex as we call them, is out. So it's like the egg is naked.
Oh. Okay.
So
Mm.
all those other factors that you can inseminate are not in place. So
Oh.
the
Okay.
best form of treatment is you pick a matured good sperms and
Okay.
you just inject the egg after they fully recovered from thawing.
Mm, okay, so this is a lot about ICSI. Well, also, I was just thinking, what really led to the development of this ICSI technology? Because I know before we got to this point of the whole, your field, people coming up with ICSI, something. Are there some things that they noticed in the reproduction technology,
Yeah.
or yeah, in the
So over
reproduction
time,
field?
they discovered that IVF is not only for those that have better sperm parameters.
Oh,
There are
okay,
some that the sperm parameter are not great, and they also need to achieve pregnancy.
pregnancy. Mm.
So the ICSIM machine was devised by that. It was brought into play to help couples with this. And apart from post-sperm, I should mention other forms of treatment like the teaser pizza, the PGT, for example, for
Mm.
those that come for gender balancing, for their family, probably they have boys and they want girls. So sperm sorting is done, and ICSI is being used to identify these sperms that are XY. Then you inject, and then at the end, the embryos are being analyzed for the chromosomes and the genes, so you can mark up that this particular one, this is the genetic makeup of these embryos.
Mm.
So for different factors, the ICSI machine comes into play and
Oh,
helps in that. Also, the ICSI machine also have what we call assisted hatching. You
okay.
can, yes, you can use, that's what you use the ICSI machine for. That's for patients that or couples that advance in age. So there's a trend you notice with women that advance in age. They have what we call, the zonals are always thick. It's like the gate of the house is very thick, in which achieving um, fertilization is always difficult. So
Difficult.
ICSI is an option for those people.
Oh,
So after ICSI and the embryo is developing again, assisted hatching is another form of procedure that you do in order to enhance
oh,
their chances of achieving pregnancy.
pregnancy.
Yeah.
Wow. So this is a lot with ICSI. Hope we're all getting this, and then you don't just walk up to your doctor and say, "I want people to do ICSI." You allow the embryologist to probably decide
Decide, yeah.
based on their assessments of you. So now, since it seems like injecting just makes it easy, you don't have to wait for whenever the sperm will get to this egg. Are your options open to doing ICSI for all IVF clients, or there are still some people that you still feel is best to have a conventional, or everybody can just do ICSI?
Well, some centers do all ICSI, and scientifically, it has not shown any data showing better pregnancy outcome or life
Yeah.
birth. So for us, what we do is based on the sperm parameters. If your sperm are good enough for insemination, of course, we do the insemination. If it's not good enough for insemination, we do ICSI. The basic thing here is maximizing the chance of patients to achieve success. So you don't all just, for sperms that are good, of course, you don't, if there is no criteria or scenario for you to do that, except of course there is failed previous IVF
Oh.
or poor fertilization rate
Mm.
from the conventional insemination, then ICSI can be done to see how to
Okay.
increase their chances. But if all those chances are not there, of course, for the good sperms, you go with your conventional insemination, and for the ICSI, we still go with the ICSI.
Okay. So is there any risk with your experience over time? Do you think there's any risk associated with ICSI? I
No, no, no,
mean,
no.
you're
No, no, no.
injecting, the way this, if you give somebody injection, they'll feel pain there. So,
So it's quite technical
okay.
from how you, if it's this process is because you're dealing with gamete life.
Hmm.
So if it's not properly done, you end up killing this thing. So once it's
Oh,
properly done, there's no any side effect. The
oh,
babies you
okay.
get from IVF or inseminations are normal babies. From ICSI, they are
Oh,
normal
babies.
babies. So there's no any effect or fear because probably you're taking the sperm, injecting. No. So far, the gamete qualities are okay. Definitely, you can achieve pregnancy and then life birth.
Okay. So, I know that a lot of people, well, I'm actually thinking, are there times, people who have this notion that once you're injecting this sperm, fertilization should be automatic. So are there times with your experience over time that someone, you did ICSI and you still did not have fertilization with the egg, maybe after injecting, and you are still not seeing fertilization? Are
Yes,
there times?
it's possible. There are lots of factors that are considered to that.
Hmm.
The quality of the sperms available for ICSI
Oh,
is one
okay.
particular thing.
Hmm.
For somebody that has very poor sperms, of course, you prepare and you're trying to select the best one. But you're looking at somebody that has very bad sperm quality. So the chances of having good qualities there is actually low.
Hmm.
So the quality of sperm can play a role in achieving fertilization. Another thing, if the oocyte quality too is poor,
Oh,
you may not achieve fertilization with that. But if both qualities are fine, great, good, or okay, of course, you can achieve fertilization. And the major thing next is achieve looking at the embryo development because
mm.
research has shown that from day one to day three, the maternal gene is responsible for the embryo development.
Oh, okay.
So the father or the male gene now comes take over from day 4 to day 5.
Okay.
So and that is where you see some cases where embryos can look good from day 1 to day 3. So when you leave them
Mm.
to day 5, they may not get to blastocyst stage
Oh,
because of
okay.
probably a challenge with the father's gene,
Oh.
either due to the DFI, poor DFI. DFI is DNA fragmentation index for
Mm.
sperm. So another thing is when the DNA fragmentation index of a sperm is high because it's in percentage,
Mm.
you can do ICSI and may not achieve fertilization.
Oh.
So high DNA fragmentation is also an indication for doing ICSI
Mm.
because with that it helps you improve the rate of fertilization.
Fertilization. Wow. So viewers, a lot about this ICSI. And yes, for me, one important point to note is you don't just automatically say you want to have an ICSI done for you. You know, I've heard some people say, do you do ICSI? It's ICSI I want to do. Like maybe they have this notion that it's just
That is
automatic.
100%
Yes,
ICSI.
it's just
Yeah.
automatic. I mean, you've injected the sperm, so what's the egg waiting for? You should just fertilize automatically. And it doesn't seem to be the case here. And that's why you trust your fertility specialist to give the best of cancer. And yes, you also trust your embryologist based on the assessment to give what's best for you. Well, so what's your counsel to people out there with respect to ICSI, IVF in general, opinions about ICSI, their thoughts and their perception about ICSI and the outcome in IVF and pregnancy generally?
Yeah, we'll encourage them to come, see, visit our place, get a specialist, then we assess them first. After assessment, then the modality of treatment will be discussed with them.
Mm.
And of course, we do this having their best interest at heart. So, whatever it is, come, let's assess you first. Let's see what the quality of your ovarian reserve look like, the quality of eggs you have. Let's
Mm.
see the quality of your sperms, what they look like. Let's do a DNA fragmentation index of the sperm to see what quality of the sperms is. So based on all these factors, a modality or a treatment option would be recommended for you. Then we'll go with that and then we wish you all the very best.
Okay, so yes, I know that you have actually talked about that. Well, viewers, I hope you've noted all the points about ICSI. I know that you've also let us know some of the indications as to why ICSI could be done. So that means a sperm can be normal and you people can still do ICSI. Maybe from your assessment, you can see a sperm to be normal and still go for ICSI based on your assessment or based on history over time or based on the kind of treatment the person wants. Is that the
So
case?
yes, all these factors like you mentioned, the kind of treatment the person is accessing can determine sperm can be normal,
Okay.
and then probably they want PGT.
Oh, okay.
ICSI is an option.
Mm.
So ICSI is definitely an option because depending on the kind of PGT they want, whether for the XY, the
Yeah.
XS, or they are screening for a monogenic disease, so ICSI can
Yes.
be a particular option. Then for the teaser, the quality of sperms now, the type of sperms. Of course, teaser sperms, they are sperms that are extracted from the testes directly. They are not
Yes.
ejaculated sperms.
Mm.
ICSI has to be an option because of the quality of those sperms is not the same thing as ejaculated sperms.
Sperm.
And how
Mm.
you prepare those sperms is not how you prepare the ejaculated sperms.
Sperm.
And before we get to ICSI, these sperms are prepared, washed,
Mm.
and assessed. So the quality of what we have left after preparing and everything, those are what we used to do to assess whether we do the ICSI or we go for the insemination based on availability. So a lot of factors play roles for this ICSI, the nature of the sperms, the quality of the sperms, then the type of treatment being assessed or care
Like
being
that.
assessed. Those
Mm.
are all the things that determine whether ICSI will be done or
Mm.
just IVF will be done.
So, viewers, I hope you've noted this point because our topic says ICSI, why and when. So you can understand now that it's not everybody that just comes for IVF that is automatic ICSI. It's individualized, and that's why it's good for you to know. Sometimes when they tell you, for instance, people that have very bad sperm, and then maybe they are explaining to them that this is the number they fertilized, and maybe they are not asking, but I thought people injected the sperm. So now you can understand that a sperm bank can be so bad, and that's also if the DFI is also high,
Yeah.
it can also affect fertilization rate. Just that okay, ICSI would increase the chances
Chances
more
of
of
yes.
fertilization
Yeah.
than if we were to go for the INSEM or like the embryologist to call it or the conventional IVF. It's been so good having you, Mr. Steven, talk about ICSI. I know it's something that seems to have really helped the fertilization rates with respect to IVF, because most times people that even come for IVF are people that have problem with either sperm or egg. And I mean, from your field, I know that people have seen all kinds of sperm.
Yeah.
I
All
can
kinds of
imagine
sperm.
what you could see with those in your microscope. Well, so um, judging from that, I know that ICSI is something that has really helped in the field of embryology, in the field of fertility and reproduction. So we have all this high standard of practice all done at Alps hospitals with very,
Yeah.
very good techniques. And then you have, like he mentioned, you're not worried about side effects once it's well done, and you have it well done here at Alps hospitals. So if you have worries, if you have concerns, if you have some questions, yes, that you don't seem comfortable with, that they're still just bothering you, and you feel like you still want to have a talk one-on-one with the doctor, you just want to still, you have things that you are searching for, you don't seem to have gotten the answers, please go ahead. You can book an online consultation, just in case you can't access us at our centers here in Jos or in Abuja. An online consultation, we're just a chat away, yeah. Phone call away or a chat away, and you'll get the information you need. But it's been good having you, our dear viewers, stay with us today. Thank you for always liking, for always sharing. Please continue to stay tuned. We're always active on all our handles, so you could reach out to us on any of our handles. You could watch out for informations being posted, for notification of videos and all of that, or whatnot you're looking out for. Yes, you could get all of that at our social media handles. But for now, we've come to the end of this session. Thank you once again, Mr. Stephen. It was a good outing with
Thank you
you.
for having me
And
once
thank you,
again.
viewers, once again for staying tuned. We wish you a very lovely evening. Bye.